So President Cyril Ramaphosa has given an update on the newly detected Omicron variant, urging South Africans to use the tools at their disposal to fight the pandemic. Government has set up a task team now to undertake consultations with the view of making vaccinations mandatory for specified activities and locations. For more on this now, let's bring in our guests. Co-chair of the Ministerial Advisory Council is Professor Koleka, Mlisana, and also joining this conversation is convener of the Progressive Health Forum, Dr. Aslam Dasoo. To both our guests, thanks very much indeed for making time. It's great to have you on the program. Dr. Dasoo, perhaps I can begin with just getting your reaction to the President's address yesterday, especially in the wake of calls from the likes of yourselves not to have a tougher lockdown. That's clearly happened, but do you reckon a task team is what we need now?
Good morning, and good morning to Professor Mlisana and your viewers. Yes, no, we're quite pleased with the President's announcement. We believe it was a measured response to the current situation. With respect to the vaccine mandate and the task team set up, we just heard about it, and we presume that it will do its work speedily and provide an approach on this very important matter, given that we do have low rates of vaccination and we do need to increase the uptake. Persuasion, of course, is always the best approach, but we seem to have hit a ceiling with that. There may be other measures that we could take, but I doubt that those will accelerate vaccination to where we need it to go. So vaccine mandates now come onto the agenda. It's a very difficult topic and controversial, and I think a measured approach to that is, will be most welcome, and South Africans will respond if it's a reasonable approach.
Professor Mlisana, what's your response to people who've already come out to say that the development of this task team is just kicking the can down the road because all the other initiatives and incentives that the government has introduced don't seem to have pushed people in the direction that we're hoping they go, which is essentially to go out and get the jab?
Thank you very much, and good morning to everybody else, and thanks for having me, and good morning to Dr. Dasoo. I fully agree, firstly, that the President's announcement last night was actually a good announcement, and it came through with clarity of direction, where we are, and what needs to be done going forward. Now, when we look, and I mean, as he mentioned very clearly, and I think every South African is now aware, that really if we are going to make an impact and be able to live with this pandemic, live with SARS-CoV-2, we need to do a few things, and we need to do those, almost 100%. And as we know, firstly, it becomes, the NPIs, social, public health and social measures. We need to stick to that. And then the main one becomes vaccination. And as he overemphasized last night, the importance of vaccination. Now, the challenge as a country that we have had insofar as vaccination is concerned is that we no longer have a problem with supplies. We've got, in fact, more than enough vaccines. We no longer have a challenge with vaccination sites. So, the sites are there. They are almost empty, most of them. What we really are in short of is people coming in for vaccination. Now, to get people to come in for vaccination, there has been a lot that we are all aware of negative talks, all the conspiracy theories. So there's an element of education that is required, and you can never educate, communities enough. But over and above that, I think, as Dr. Dasoo says, I fully agree with him. I think we've come to a point now where a lot of means have been done to get people to come to vaccinate. Now, when he announces the setup of this committee, I think we all are looking forward to that because we feel it is the time for that. In fact, we, almost around the circles, we're already starting to say, when are we talking mandatory vaccination? Because we have heard this come from the private sector, from the, from most companies saying this is time for that. And so it's good that it is now on the table within the politicians. Now, for me, whenever we talk mandatory vaccination, it always takes me back to us as the healthcare workers, because this is not a new concept. Every medical student well, during our time. When you go to third year, when you're going to be meeting with clinic, with patients, we knew that you were going to take a hepatitis B vaccine. And that happens in the healthcare worker. So it is not a new entity. It's not something that we have not, we're not doing. So really for us, specific, areas we need to consider, vaccination mandatory vaccination. I fully agree.
I hear you, Prof. But the thrust of my question is around whether or not we have the luxury of the time to go via creating a task team before getting to what people are considering the inevitable. I mean, is this just the president taking the long route to a solution that it appears a lot of people agree would actually solve the crisis that we're in, at least in part?
Well, I don't think everybody necessarily agrees. And I suppose, from the president's seat, if he just goes without any negotiations, it's going to be a problem. And so, but we are all hoping that there are going to be timelines to this committee. And I think for me, that's what is going to be important, because this is something that needs to be initiated as quickly as possible. So that consultation has got to have a timeline. So we are all clear. We don't have much time. I fully agree with you. But then there's a need for consultation. It's going to be a matter of how long that consultation process is going to take.
Dr. Dasoo, how do you see this issue? We live in a context where, quite frankly, some things many would agree are non-negotiables. Yes, we don't know much, for instance, about how Omicron responds to the vaccines, but we do know enough to say with a good level of certainty that the vaccines, at the very least, are effective. Is this something that the president should go into negotiation with, given what's at stake?
I think it's going to be less an issue of negotiation and more one of exploring the dynamics of something like this and the logistics of managing it. And I think we need to have those things in place all at once. So presumably, I'm not sure what the terms of reference of the task team are, but that presumably is the crux of it. Look, this is a worldwide phenomenon. Mandates are in place in many, many countries. I also agree with Prof. Mlisana about this is not a strange matter. We all take our children for vaccination because you can't send your child to school unvaccinated, and we do this willingly. So there's no real barrier to taking the shot. The one thing I might say is that perhaps our communication needed to be less corporatized, more targeted, especially to poorer communities, where the high-level communication sometimes just passes them by. And trusted local leadership, using the idiom in which people are accustomed to, may have persuaded more people. But we don't have the luxury of time, as you mentioned. And I think we need to take measures now that rapidly accelerates the vaccination rate. We are kicking off on a fourth wave, we know that, but the infrastructure, as Professor Mlisana says, is in place. Perhaps we can get more vaccines directly to the people, and then the department will need to look at that. But right now, if we can, in a short space of time, settle the constitutional, legal, logistical, infrastructure considerations around vaccine mandates, this is what might happen, where all public venues, restaurants, bars, whatever, events, you will need it to show proof of vaccination. That's all that really means. And the one thing we need to do is not just leave it to the people. I think we need to enlist the proprietors into this game, because what the president said last night was very interesting, especially around the alcohol ban. So you could have an alcohol ban and those businesses would close, or they could enforce the requirement to show a vaccine, to show proof of vaccination before you enter. You could get more draconian, I understand, where if you are found in your premises with people who are not vaccinated, you may stand to lose your license. I don't think we need to go there, but it's certainly a tool in the toolkit. Some countries do that, routinely.
Right.
So it's really about the terms of reference and the time frame for this task team, but I expect it to be short and sharp and having the right people in that task team to give us the way forward.
In the president's words yesterday, he said that government has set up a task team that will undertake broad consultations on making vaccines mandatory. So the sense we got is that it really is about some kind of negotiation, but hopefully it's also about the practicalities of introducing something like this. Professor Mlisana, with the time that we have, the President also yesterday mentioning that if the situation doesn't change, in other words, if the infection rate continues the way it is, the country won't be able to stay, for instance, on level 1 of the lockdown for very long. Are you getting a sense that we're coming up with enough creative ways of responding to the pandemic, especially in a context where there's been so much criticism about a lockdown and the impact it has on things like the economy?
I fully agree. I mean, we have been going through this, and it has not been an easy road. And actually, is coming in when, even now, as the Ministerial Advisory Committee for COVID-19, we were beginning to say, how are we going to live with the virus, and what therefore should be the long-term plans? What is it that should be happening? But now we are now forced to look into the fourth wave. But that's a conversation that is important and that needs to go on, because we really need to find mechanisms of living with the virus going forward. So it is important what the President said, because what it actually does, it gives us time, especially because we still don't understand a lot of characteristics of Omicron. So we have got the next few days to a week or so to see what is happening to the numbers that are infected, what is happening to the positivity rates compared to the, to the numbers that are getting tested. And secondly, and most importantly, what is the clinical picture? And therefore, once we know that, and that's what, those are the parameters we want to look very closely at, so that we then can make, an informed decision. And obviously, we are all waiting to see the results on how the immunity responds to the new variant. So this is giving us time, whilst at the same time, as we've been chatting, we're increasing the vaccination rates. We will be able to see what the best way is going forward. And we really are hoping and trusting that South Africans are going to pitch for vaccinations, because that is the one, mode of prevention that we know that works and is effective against severe disease and death.
Professor Koleka Mlisana is the co-chair of the Ministerial Advisory Committee on COVID-19. Dr. Aslam Dasoo is the convener of the Progressive Health Forum. To both our guests, once again, thanks very much indeed for your time.